So I have to look at the camera, not you, because normally the normal thing would be to sure.
Good afternoon. Welcome to another Facebook Live session with SpeakingTree.in. My name is Ishita, and let me start off by sharing some startling figures with you. Do you know that according to International Osteoporosis Foundation, nearly 50 million people in India are either osteoporotic or have low bone mass? Not only this, almost 1 out of 8 males in India and 1 out of 3 are affected from osteoporosis, and we are one of the largest countries affected from osteoporosis in the world, states WHO. To talk more about bone health, we have Dr. Jayant Arora live with us today. Dr. Arora is an orthopedic consultant and a joint replacement surgeon in Gurgaon. He is the Chief of Orthopedic Surgery at Columbia Asia Hospital and Director of Gurgaon Knee and Shoulder Clinic. He has been trained in the UK for several years and has expertise in knee replacement surgery and treatment of sports injuries. Welcome to SpeakingTree.in, Dr. Arora. Dr. Arora, to literally start off with, these are extremely startling figures. Why do we as a country score so poorly on bone health?
Well, I think osteoporosis is not just a problem that we see in India. It's a leading cause of fractures all over the world. In India, we are now seeing it more and more often. Primary reason is that over last few decades, the average lifespan of Indians have gone up. Okay. In earlier time, the average lifespan was 50 years, maybe 60 years. Now, on an average, we are seeing people living in their 70s and 80s, and that is when really the osteoporosis strikes. More so in women, less in men. But as we become healthier, as we live longer, we will see more and more of osteoporosis in times to come.
Which is obviously not a very good news, Doctor. Doctor, you just mentioned that women are more affected by osteoporosis than men. Is it like a genetic thing, or why is it the reason that and this is very worrying, of course?
Agreed. The reason women are affected more than men are two. A part of it is genetic. Men generally are bigger with stronger bones, and second, it is hormonal, physiological. In women, after menopause, due to hormonal changes, bone mass dives down suddenly. And typically in women post their menopause, the quality of bone strength, the bone density, it keeps on decreasing. It's a one-way slippery slope. So that is why women are most commonly affected with osteoporosis.
And of course, we're taking questions with Dr. Arora. Is going to be with us. So please write into the question in the comment section and we'll try and get them answers. Doctor, one very funny fact about calcium in the food we eat. A lot of people know that iron is found in green veggies, but for calcium, there's a lot of hearsay, as I can put it. People know it's found in milk, but apart from milk, what are the other really sources of calcium, and how can we actually have more calcium in our diet?
Yeah. But having said that, if you come to think of it, milk or milk-based products, they are the richest source of calcium. They are pretty much taken by everybody, whether your dietary preference is a vegetarian or a non-vegetarian. So, and I'm talking on any milk product, not only just milk. So it could be yogurt, it could be lassi, it could be charge, it could be cheese, it could be paneer. So anything which is dairy-based has excellent amounts of calcium. But apart from milk, the other foods which have some amount of calcium would be fruits like oranges, dried apricots, dried figs, kale, so there are some other items, and similarly non-vegetarian food have some amount of calcium. So, but for all practical purposes, dairy products are the way to go.
Absolutely. So dairy products are the way to go. Yeah. And apart from food, what really in terms of exercising and little 2-3 tips that you can share that people should do every day for better bone health?
Excellent. So I think calcium has a not that big a role to play, to be honest. Of course. Probably it is a little overrated. What is underrated with regards to bone health is the lack of exercise. And I'm sure recently there was a big study in Lancet which singled out India as one of the areas where people do not exercise enough. And it is the lack of exercise which has a far bigger impact on bone health than lack of calcium in the diet, because we do not lack calcium in our diet. What we lack is exercises, and maybe what we lack is vitamin D, because vitamin D is critical in absorption of calcium. Even if you have adequate amounts of calcium in the diet, but if you don't have enough vitamin D in the system, the calcium is not absorbed. But I would like to take this opportunity to emphasize to our listeners that it's the lack of exercise which is the most important culprit of poor bone mass.
Right. And of course, please write in with your questions. We've already started receiving questions that, you mentioned calcium, and Sweetie wants to know what are the supplements women in particular, India is not very open to taking supplements. We always say that, we shouldn't take supplements and things like that. So what should you look for when, when you're buying a supplement, and are there any particular supplements that you recommend as a doctor?
No, I'm not a big fan of supplements, is the honest answer. The only time when I would recommend a supplement to somebody is, is essentially when I worry about vitamin D deficiency. I often ask my patients to take calcium through diet. Having a well-balanced diet, getting lots of fruits and vegetables would pretty much cover up for most of the vitamins. The only other vitamin which might be deficient in a vegetarian diet could be a vitamin B12. So maybe vitamin B12 supplementation can be taken, but vitamin D is often found to be low. It's not only in India that we are seeing people with deficiencies of vitamin D. Even in Western world, the vitamin D deficiency is rampant. However, in Western world, most of the food products are supplemented by additional vitamin D. Nestle will give milk which has vitamin D, juices will have vitamin D, bread will have added vitamin D. So most of these companies, the consumer products will have added vitamin D. So people are eating vitamin D as a form of supplement without knowing that they are taking supplement.
Absolutely.
In India, that has yet become a norm, and that is why population has to take vitamin D on their own.
Right. Doctor, unlike other body parts, like, you'll get to know when your eyes are getting weak, or, when you're putting on weight, you'll see the extra flab. Since we can't see our bones, what are the really early warning signs, apart from aches and pains, which are not very, very high? I mean, you just get a niggling pain here and there, you take a painkiller and sleep it off maybe. What are really the warning signs that, you are suffering from a serious bone problem or osteoporosis, and how should you really start taking action? When should you really start taking action?
So I think that's an excellent question. Very, very apt question to ask. The reason why we talk about osteoporosis, and it's not this talk, you would find a lot of other resources on internet about the problems of osteoporosis. The reason is that this is called a silent disease. There are no signs and symptoms. It just hits you when you're older, and it leads to fractures with trivial falls, fractures which are serious, which will make you debilitated, which might often need surgery. So the best way to protect you from osteoporosis is to look for it, take measures right from an early age. And in elderly people, when I say elderly, I shouldn't use the term elderly, I should use the term middle age. So from 55-year-old onwards, the only way to know about your bone density is to do checks. We do tests called bone densitometry. So through that we can check it, but younger people do not need to undergo that test.
Okay, great. We of course are taking questions. Doctor, we of course have a very relevant question. Purnima wants to know that, with the sitting jobs, like, all of us do, back pain is a very normal condition. So do you have any quick things or quick tips that you can share for back pain which is not chronic? It happens like, say, once a month or something like that. Should you improve your posture, or there are 2-3 things that you can probably share with us?
Yeah. So I think back pain for most of our population, younger population who are sitting in the office for long hours, is primarily, it's not a health issue, it's more of an ergonomic issue. Which means that the way you are sitting, your sitting posture, the type of chair you are sitting on, the position of your computer, and the height of your table. So all these things have a big impact on your back pain, neck pain even. So ideally speaking, you should have a chair which should be high. It should have an armrest. When you're sitting, you should be leaning 110 degrees backwards. You should have an lumbar support. So these are the things that you need a proper place to sit and a proper posture. Apart from proper posture, even if you have a proper chair, if you're working non-stop without taking a break for many hours, 3-4 hours without a break,
right,
that would also cause back pain. So we recommend our patients that after every hour they should leave the seat, move around, stretch their back, do a little bit of stretching exercise, couple of minutes, nothing more than that, just 2 minutes, and then get back to their seat and get back to working again. So after a 10-12 hours working day, it's very difficult to push yourself to a gym or to do some sort of exercise. Would believe you me, that is the answer.
Right.
There's no point popping in pills for back pain. They never work. It will only give you temporary relief.
Absolutely.
Exercises, right posture, right sitting areas, and frequent breaks. That's the answer for majority of our patients.
Right. And doctor, one thing I wanted to know is that, once you get like you break a bone or you get a fracture, a lot of people are wary of exercise. They're like, "Ki nahi, hamara pair toot chuka hai, we should not." So what do you recommend for those who do suffer from osteoporosis? What are the kind of exercises they should not do? We've spoken about the fact that people should exercise, but are there any special exercises that people should avoid if they suffer from osteoporosis, or one they should regularly do?
Yeah. So I think I'll probably divide the population into two groups. One, who are younger, who would want to stay away from osteoporosis, and second group is the people who are already in the older age group and who have osteoporosis. So I think kind of exercise would be completely different. I think let's start with younger population because India is a young country. So physiologically, when we are growing up, the peak bone mass, the maximum density of bone happens at the age of around 25 to 30. After that, the bone density will not increase. We can at best maintain the density. So the better bone mass you have when you are 25-30, lesser are the chances that you will develop osteoporosis. So prevention of osteoporosis do not start when you are 30, 35 or 40. It should start much earlier. It should start when you are 20, in your 14s and your 15s. And the best way to have a peak bone mass, which is good enough, is to do strenuous exercises, running, playing, jumping, people going out to the park, which most of our kids don't do nowadays, unfortunately. So that's the critical part. Strenuous exercises done in a younger age will protect you from osteoporosis later on in life. But it's never too late to start. Even when you're 30, 35, exercises will never do any harm. Working out in the gym, running, swimming. Swimming probably doesn't improve bone density that much, but other impact exercises, playing badminton, playing tennis, playing cricket, running, jumping, skipping. So anything which transmits forces through our body will improve the bone mass. So that is for young people. For elderly and for people who have osteoporosis, we advise them to do nothing more than go for walks for improving bone density of their legs and hips, and to take 1 kg dumbbells in their arms and do simple exercises like we used to do in our school time, PT
Yes,
session.
PT session.
Just with 1 kg dumbbell and nothing more than that. And of course, we also rely on medicines for that age group.
Of course, please write me the questions. We have a very interesting question. Anu wants to know that sometimes even children, say that, their knees hurting or, probably their shoulders hurting. So have you seen cases in your professional career about children getting osteoporosis, and what really can we do as parents? Not osteoporosis, if not osteoporosis, then like a weak bones and stuff like that. What can we really do to prevent our children? You said, they need to go out. So if you could just, throw some light on that.
Yeah. So you correctly said children never get osteoporosis. We never make a diagnosis of osteoporosis in children.
Absolutely.
Usually children are not the common attendees in an orthopedic clinic, but once in a while we do see children with pains here and there. Reasons could be varied. Usually it's a muscular pull. Sometimes it's a growth related pain. Sometimes it's a little bit more serious. We always take it extremely seriously if a child is complaining of repetitive pain in the same area, because children will never complain of pain. Even if they have pain, they'll be more interested to go out and play rather than tell their mom, okay, I don't want to go out and play because my knee is hurting. They would rather go out and play and not tell their parents. So usually if a child is sitting in your clinic complaining of pain in the knee or pain in the joint, we shouldn't take it lightly. We have to take a great detail of care to figure out why it's paining. It's not osteoporosis, let me tell you that. Yeah.
Okay. Dr. Sarita wants to know what is the easiest remedy for knee pain. So what can she do for walking, or I think she's asking for specific exercises that she can do.
Yeah. So I think knee pain is not a problem, it's a symptom.
Oh, okay.
Okay. So knee pain is a symptom Reasons could be thousands. So one has to figure out why somebody is getting knee pain. Is it arthritis in the knee, which is one of the commonest sources of knee pain, or is it due to some muscular imbalance, which is also fairly common, or is it some sports injuries like a tear in the ligament or the meniscus? Sometimes pain from the hip can get referred to the knee. So again, people who have recurrent knee pain, young or old, they need to see the doctor. We have to figure out why knee pain is happening and then treat it accordingly. There is no simple remedy for knee pain per se.
Right.
Yeah.
And correlation to that, we had a question earlier. Shilpi had asked that. It's a very interesting question. She's asked that rise in knee replacement surgeries in particular. It's gone up in the last 10 years. Of course, it has to do a lot with a sedentary lifestyle. So what do you have to say about that? And what shift do you see in terms of people actually going out of the way to better their bone health?
Yeah. So again, I think knee replacement or the incidence of knee arthritis has not it's not related to bone health that much. It is again related to lifespan. In India, we are seeing more and more patients who need knee replacement every year for last 10 years. But this trend has been happening in Western countries for more than 50 years. So if maybe 10-20 years ago, if we were doing one knee replacement in India, Western countries were doing 20 knee replacements. Reason being that in an average Western country, Europe or Australia or US, the lifespan is around 80-85. So by that age, everybody's knees and hips both, they get damaged. And once they get damaged, people get pain, and those people eventually then end up with a replacement surgery. Now that trend has started in India because we see our population living longer. We very frequently see people in their 75s and 80s and 85s, and this is the time when people start to get pain. Yes, but at the same time, we do see a fair amount of people in their younger age groups, 50s and early 60s, who also have significant knee arthritis. I think part of the problem is due to weak bones. Part of the problem is due to weight. Sometimes it is the weight which is causing the problem. So it's not just bone health, it's more than that. But yes, trend of knee arthritis is on us. We'll see more and more in the times to come. And knee replacement is one of the best solutions and a time-tested solution. It has been done for more than 50 years to treat this condition.
Absolutely. And we don't have much time left, so please write in with the questions. Doctor, you mentioned exercises as part of your daily regime. Shivani wants to know, do you recommend yoga, as part of, your bone building, one of the forms of exercise? Do you personally believe in it, and do you recommend it to, probably your patients or generally to friends, or you yourself do it?
Yes, I think yoga is an excellent way of keeping your body supple, maintaining a good core muscle strength, which is so important for your back muscle pain prevention, neck pain prevention, and it improves the mobility of the joint. So yes, yoga is an excellent way of keeping your bones and joints supple and healthy, and I absolutely recommend it to my patients.
Okay, great. Doctor, Sally wants to know that she suffers from minor cervical here, and she does exercises at home, and she feels better after these exercises. What she wants to know, is it okay to continue like that? If if she regularly does exercises at home and not take any medication or go to the doctor? I think she might have consulted a doctor before. She's not really clearly mentioned that. So for cervical, normal, regular home exercises are okay. I mean, she says her head starts spinning once in a while, and she does exercises and she's fine then. So for that...
So again, it's a very, very common presentation that we see. I wouldn't say that, okay, ignore all neck pain. So I think term cervical is used loosely. Every neck pain is often referred to as cervical, which is not true. Cervical means cervical spondylosis, which is a medical term. This condition is essentially seen in people in their middle ages, 45s and 50s and 60s, and it is due to wear and tear changes. But it's not seen in people in their 30s and 20s. And often everybody in their younger days who get neck pain, they call it a cervical, which is a misnomer. Having said that, the problem in younger people is usually, not always, it is usually because of muscular issues. I should call it tech neck rather than a cervical. All of us are spending time looking at our phone screens, and it's a technology-induced neck pain That is the commonest source of pain in today's time. So yes, exercises will help. But apart from exercises, improving your neck posture, avoiding looking at phone screens for too long. Maybe some of your viewers are looking at phone screens right now, but that is one of the common reasons of people getting neck pain.
We're all guilty of that. Doctor, this is not really a question per se, but it's more of an observation. A lot of people, as you mentioned, sometime back in a conversation, that they pop painkillers. So if you can just throw some light on self-medication and how harmful really it is, and people should not do that.
Yeah, so I think popping painkillers is the worst thing that somebody can do to themselves if they do it without a very, very good reason, because painkillers only suppress the pain, and eventually in the long term they will have some form of side effect. Either you'll get used to it, you will become addicted to certain types of painkillers. They can give you acidity, they can give you ulcers, and at worst they can damage the kidneys, and people need dialysis. So if you're really worried, if you really want to know how bad painkillers can be, take one day out, go to any hospital, visit the renal department, talk to the people who are on dialysis. All of them have been on painkillers at some point in their life, or majority of them, and they end up getting dialysis throughout. So there is no replacement for kidneys. We can change the knees, but we can't change the kidneys. So don't pop in painkillers. Don't do it yourself.
I think we have just time to take one last question. Doctor, we say as we age, of course, our metabolism slows down and things like that. So is I'm not saying that everyone can get osteoporosis, but is it like does it really happen at a certain age? Is it unavoidable? Or you mentioned, of course, exercise really helps. But are there any more, tips that you can give to prevent, or, maybe after 60? As I said, of course, your biological clock is ticking. So obviously, like your eyes, your bones will also get weak. Yeah. But are there any tips, final tips that you can share, maybe for youngsters that, maybe late teens or early 20s that, really start doing this?
Yeah, so I think, as I mentioned earlier, to prevent osteoporosis, things have to start at a much younger age. Broadly speaking, to prevent osteoporosis, it's a combination of regular exercises, good amount of calcium, maintaining good amount levels of vitamin D, and when we are older, checking your bone density, because it is bound to go down.
Of course.
And once it is going down, we can stem it by using medicines. So there are medicines for osteoporosis which are extremely effective. It's just that people don't feel any symptoms from osteoporosis, they never get it checked, and they only find it out when they sustain a fracture from it. So getting regular health checkups done in the older age group, and taking appropriate treatment for it. So that's the overall treatment for osteoporosis.
Okay, great. I think that's the time we have today. Thank you, Dr. Arora. Thank you so much for joining us. It's been a lovely session. I think the audience, the viewers who are watching this will take a lot of tips from you. Thank you so much. If you want to say some last words about the session, about yourself, feel free.
It's a wonderful session that we have discussed about a lot of common problems.
Yeah.
And I wish your listeners all the best and lead a happy life and healthy life.
Thank you.
Thank you very much.
Thank you so much, Doctor. And this is all we have for today. We'll be coming back soon for another Facebook Live session for your daily dose of spirituality. Please keep logging to speakingtree.in.